Okay, well, greetings everyone at Bell Medical Land. We have 31 participants on this call, so I'm excited to have seasoned veterans and some of our new people. As I discussed earlier, this was set up primarily for some reps that David Watkins sent out a sample box to that are new to our organization. Some of the folks, like I discussed, Jason Lowry out in Biloxi, Mississippi, and several of his teammates in the South there. So what we're going to start off with is first of all talking about the anesthesia call in general, because many of the people that we've just added on are like orthopedic salespeople, or they're maybe calling on GI, or they're in the hospital and surgery center environment, but they're not necessarily making the anesthesia call. So the first thing to talk about is, let's talk about the hospital, and then we'll talk about the surgery center and how they vary. The players that we would talk about, especially in a hospital, would be the anesthesia tech. Anesthesia tech is a relatively low-paid employee of the hospital that is there to assist anesthesia in any capacity. Often they are the person that goes to get something, and in different facilities they can have different responsibilities. Sometimes they're doing relatively sophisticated things like setting up art lines, but a lot of times they're just helping with the changeover of a room, and they do a lot, but they're generally a fairly accessible person in the operating room. The other contacts would be a CRNA, which is a certified registered nurse anesthetist, an anesthesiologist, which would be the MD, OR manager, and an OR buyer. So all 5 or 6 of those contacts are people you want to ask for. Versus the call on a surgery center is more of, you would go into the surgery center desk and say, may I speak to anyone in anesthesia? They would probably say, oh, those anesthesia providers are busy right now. Can I help you with somebody else? And then in that case, you would ask either for the OR, the surgery center materials manager, or the nurse manager of the surgery center. So those are kind of the call points. Now, when we talk about the hospital, many of you that are selling orthopedics know where to go and what to do, but some of you that are just new to hospital sales, you'll often see double doors that'll say do not enter, and that's exactly where you need to enter. So generally you've got some kind of appointment these days with somebody in anesthesia or somebody in the hospital, but when you get to those double doors, often you just got to walk in, and the thing you want to avoid is you want to avoid going over a red line, because that's where you need to be dressed out. But generally you can go through those double doors, you'll go to the OR desk, and at the OR desk you will basically ask for someone in anesthesia. And basically you want to talk to anyone in anesthesia, because if you end up with a CRNA or an anesthesiologist, they can tell you who to talk to about new products and things like that, and hopefully those people you can actually show our catalog or some of our products. So that's kind of the lay of the land as far as the hospital and the surgery center. I would say once you get somebody, and let's say you end up with an anesthesia tech, which is probably a common situation. If they say everybody's busy, then say, can I speak to an anesthesia tech, or do you have an anesthesia tech available? And hopefully one will come out, and then you can just basically introduce yourself. I always recommend having a 15 to 20 second commercial about yourself, and then a 15 or 20 second commercial about who Bell Medical is. And basically Bell Medical is an anesthesia specialty company that basically delivers new technology to anesthesia providers. And we import that technology from really all over the globe. As you'll find out, our eye protection products and VITA Knee come from Australia. The Zavant Stim Pod comes from South Africa. Our absorbent comes from the UK or Northern Ireland. We import intubation devices from China. We bring in capnography products from Malaysia. So we truly are a global company and a global importer of record for these companies. So that's kind of my commercial on Bell Medical. I often represent or explain to them that Bell Medical has been in existence since 1975. And I personally have been with the company since 1986. and once again, I would recommend saying something about yourselves and your family, etc. But your goal is to get in front of somebody in anesthesia. So if you're an orthopedic rep and you're in the OR, then you know some anesthesia people already, and you want to kind of introduce yourself to them and let them know that you also represent a fine company that specializes in anesthesia-related products. So, and the key thing I would have you do is basically show them our catalog. So one of our strategies is basically catalog selling. I bring in, and we'll talk about a bag. I bring in a bag with me of samples, and I have a system with that I use that works for me. But you all can easily carry a couple catalogs in your briefcase, so please make sure you do that. The thing I want to emphasize most is as you get more comfortable with the products that we represent, but even before that, the key to any sales call, in my opinion, is asking the right questions, or asking questions in general. We've all heard the saying that God gave us one mouth and two ears, and the reason is we should spend more time listening than we should be talking. And the key way to get the customer to talk to you is by asking them questions. So that's basically sales 101, but it is the thing we don't want to do is necessarily do a feature function benefit dump on them, if you will, about all of our different products. So what I think that is nice about catalog selling or presenting the catalog to them is that it leads you through the questions that you might ask. And it helps you to not forget things. I've gone on sales calls that I thought were excellent. We talked about 2 or 3 really good things, and then as I'm walking out of the operating room, I realized, oh gosh, I didn't talk to them about laryngoscopes, or I forgot to ask them if they're budgeted for any capital equipment this year. So this catalog will help you to not forget certain things. I've had sales calls where I got in front of an anesthesiologist and an anesthesia tech, and they said, I only have a few minutes. And I said, well, okay, that's fine. Let me show you a few things from Bell Medical and what we're about. And I open up the catalog, and they end up literally spending 20 minutes with me, and they end up saying that they have interest in several things that we have, and they're asking for samples and things like that. So let's start off then by talking a little bit about the catalog. So you've gone into the OR, you've asked for anesthesia, they've told you so-and-so can talk to you, you're talking to an anesthesia tech, anesthesiologist, or a CRNA. It really doesn't matter, because this is all things that they'll be interested in. So real quickly, the cover of our magazine has the StimPod 450X on it. That is a quantitative train of 4 nerve stimulator. It has the ability now to do both accelerometry and myography. So that is AMG and EMG technology. So that's a big plus. Now, it doesn't talk about EMG capability on our catalog, because our catalog was produced before that was introduced. But we do have a document called Road to Success on the StimPod that reflects the new EMG capabilities. So right off the bat, in the cover, you would ask a customer, do you have any interest in quantitative train of 4 monitoring? And if they don't have any interest in it, then let me show you what else is new from Bell Medical. But you might say something to that effect, well, there will be a time when this becomes a standard of care, and the thing you need to remember is that we have the capability of doing it with accelerometry that uses standard electrodes that don't cost you anything, or we have EMG capability that uses an electrode array that works off of muscle contraction and muscle electrical activity, and thus can handle a hand that is tucked. So the point is, we are the only device that is able to do both AMG and EMG in the same device. All you do is change cables, and you're off and running doing whichever technology you want. The AMG technology, or accelerometry, is proven, and it doesn't cost anything per patient to do, because the electrodes we use are the standard electrodes that you would use on ECG. So they virtually cost pennies or mils. Whereas the EMG technology does require a special electrode array that could be in the neighborhood of $20. But the point is there's other companies out there that are only selling an EMG system, and thus every time you use their device, you're looking at $20. So that's the cover of our document, or our catalog. And I often page through and talk to them about, we do all the different airways, but we have a special airway called a spreading airway, or a split airway, and that's used for difficult intubations. We have, and sometimes what I will do is I will earmark pages that are focused products for me. I'm going to just tell you we have a great emergency crike set, but that's not one of our lead with products. One of our lead with products is the Capno mask. And if you have your sample bag there and you talk about capnography, this is an example of when you might ask a question. You might ask the anesthesia provider, you might tell them, hey, we have a new mask that's designed to deliver oxygen and sample CO2, and it has a vanilla scent to reduce post-operative nausea and vomiting, or PONV. And studies show that fragrances actually do help to reduce the effects of anesthesia that can disturb someone and put them in a vomiting situation. So one of the questions you might ask when you get to this product is what do you do now when you're needing to deliver oxygen and monitor CO2, and you want to do it with a mask? Most people use nasal cannulas, and we sell a great nasal cannula that I'll talk to you about, but you would ask them, when you want to use a mask, do you MacGyver a mask by putting a gel coat catheter in it, or just tuck the sample line under it? And almost all of them say yes, they've done that before. Well, what's nice about this vanilla scented mask is that it is all together. All they have to do is open the package, and everything is there. The sample line's there, the oxygen tubing's there, and the mask is all connected and ready to deliver oxygen and monitor CO2. So that's called the Capno mask, and we have a Road to Success document for that. And when you get to that, you'd ask them, can I send you samples of that, or can I deliver samples? Now, I have a love-hate relationship with this next product. I love talking about it, but there's times when it's frustrating, and that's called the Pom Mask. The Pom Mask stands for Procedural Oxygen Mask. And a procedural oxygen mask is still relatively unknown out there, and the anesthesia people that you show it to all immediately say, oh, that's a great idea. And basically what it is, it's for upper GIs. When I mentioned you call on the anesthesia department, we never want you to leave a hospital without walking over to the GI department, because anesthesia does anesthesia in GI also, but that's where we can really make money, is in our capnography program offering, if you will. So I'll mention toward the end of this the areas that I think are money opportunities, but capnography continues to be one of the areas that we excel in, and reps end up making a lot of money on. So the reason I don't like the Pom Mask is we don't have it exclusively. The Capno Mask we virtually have exclusively, whereas the Pom Mask, Trianum also sells it, and we've often done a lot of work and they end up getting it. The reason I still recommend showing it is because it's good for your customers, and they'll appreciate the fact that you have something unique for an upper GI. Usually in upper GI, they're doing ERCPs or EUSs. Those are fairly long procedures that are upper orientated in the GI lab, and you will use this mask and they will like it. Our cannula is called the Comfort Soft cannula, and that is something that you'll find. Jason, we sent you Comfort Soft cannulas and Iridium samples. Excuse my looking away. So one of the nice things about the Comfort Soft cannula is that it is a Bell Medical labeled product. So there are other nasal cannulas out there, and there are others that are soft like ours, but not as many. But ours is private labeled. So when you show ours and you quote ours, you know, they're gonna, your chances of keeping that business and earning that business is significant. Now, one of the things that I always recommend is take your sample and open it up with the little package, and then I always put them into a Ziploc bag, if you will. Where's my Ziploc bag? So I recommend buying the Ziploc bags that have the little control system there, or the little Ziploc tab, if you will. And then I recommend taking the insert and putting that in, and then actually loading your sample into that. So what ends up happening is you're able to keep track of your samples, and every time you open them, you have them kind of secure, and you're ready to open them, and you have the insert in there also, so you know what it is. So here happens to be my Pom example that I have in a Ziploc bag. So when I open that up, I'm able to show it very easily to the customer. It's all connected, and this is the essence of an upper GI mask, where they would put the scope through this opening here. So we would attach a CO2 line here. We have a reservoir bag. We sell this with the reservoir bag or without. It's slightly less expensive, of course, without the reservoir bag, and anesthesia typically doesn't care that much for the reservoir bag. They just turn up the O2 flow. So this is the example for the Pom mask. CO2 is sampled there. The oxygen is sampled there, or is delivered there and through this tubing. So once again, you put your samples in a Ziploc bag, and they just last longer for you. They keep them organized, and it works out a little bit better. Okay. Going through the catalog a little bit more. The best thing to do when you're at a GI lab is literally ask, can I see, usually a GI lab, the room is not sterile, or they are always not sterile. And if there's an open room, you should go in, take a picture of their gas machine if they have one. A lot of times they don't. Take a picture of their monitor, the front and the side, and then ask to see one of their CO2 sample lines and take a picture of that. Send it to me, and then I can develop a strategy for you that can help you. But while you're there, you could basically say, we would like to bid on your capnography supplies. We can always save a GI lab money. Okay. We also have a section called Iridium Compatible. Iridium uses, and this is actually our Iridium Compatible. Once again, it's private labeled, sells Bell Medical on it, and it has the Iridium connector on it, which is this orange connector with the gold piece on it. This is the product that Neil Ward is selling to Intermountain Health, and he's getting commission checks in the $8,000 to $12,000 a month category. So capnography is a high use area where we can make a significant amount of money. We pay roughly, well, we import these from Malaysia, so they don't cost us a lot, and we're able to save hospitals close to 50% from what they're doing now. What they're doing now with Iridium-enabled products, they're costing them $11 to $12.50 at a minimum each time they monitor CO2, whereas ours are about half that cost. Okay? So that's what all these pages on capnography have to do with. They basically have to do with the fact that we are a specialist in capnography. And just briefly, for those that may not know exactly what capnography or end-tidal CO2 is, but every time we inhale air, which is 21% oxygen, we exhale CO2. So CO2 monitoring is now used to take a little sample of your exhaled breath and make sure there's CO2 present. So it's a very sophisticated way to indicate that your patient is continuing to breathe. So in the GI suite, for example, they have a patient in a darkened room, and they have them on their side, perhaps. In the old days, they literally used to have the hand in front of the patient's face and just feel for breath to make sure they're continuing to breathe. Or they would watch for chest movement. Well, now they put a nasal cannula or a mask on the patient with a CO2 sample line. That CO2 sample line goes back to a CO2 monitor that measures CO2 with every breath. If Michael Jackson would have had a CO2 sample line on when he went to sleep via his doctor with propofol, he'd be alive today because the CO2 would have alarmed and let them know that he is no longer breathing. and they would have gone in and recovered him. Same thing with Joan Rivers. Joan Rivers was in a procedure, upper GI procedure, I think, or some kind of procedure, and they decided to do a little extra thing and look at some vocal cords or something, and while they were doing some different things, they were taking pictures of her. Well, they didn't realize that she wasn't breathing, and the sedation that they had given her had put her to a level that was more like a general anesthetic than a procedural sedation, or conscious sedation is what they're called. So CO2 monitoring is a life and death monitor, but it's a very sophisticated way to make sure that your patient is still breathing. So every time you take a breath, you exhale, it senses CO2 and it's telling that monitor that you are still breathing. So it's a standard of care in the OR and wherever they're doing conscious or procedural sedation, such as cath lab, GI labs, and even the ED. As I page through this catalog, I come to a part that's on anesthesia carts, and you just ask them, do you have any need for any anesthesia carts or difficult airway carts? We are a supplier of carts, both metal and aluminum. And at that time, they say, no, I don't have any needs, then you just move on. One of our areas is specialty is absorbent. Whether you are in a territory that has the ability to sell Amsorb Plus, or you still want to ask this question, you want to ask, what CO2 absorbents are you using now? The nice thing about selling CO2 absorbents is any place they have an anesthesia machine, they are also buying CO2 absorbent. And so you want to take a picture of what they're using now, or identify what they're using now, and call me, and I'll be able to give you a strategy on how to earn that business. And what's great about Capnock or absorbent sales is that they're using it daily and weekly, and it's that recurring annuity that we're looking for all of you. So right now we actually have 3 choices of absorbent. So we have solutions for every territory and every situation. So I'm pretty excited about that. Most of the country we lead with the Amsorb Plus, which is a great product. So we'll have a discussion on that specifically. As I page through, I get to endotracheal tubes, and if you're talking to a surgery center, that's an area where we say, can we bid on your basic supplies of airways and endotracheal tubes? Because we sell both specialty tubes and traditional tubes for the airway. Now we're getting to eye protection, which is one of the areas I want the new folks to focus on, because it is such an easy sales call. It's easy for you to understand, and it's easy for the customer to grasp what you're offering them. So let's talk a little bit about the eye protection products, and that's 2 products along with VITA Knee that we import from Australia. And Andrew Wallace designed these devices basically by looking at what they're doing now and saying, how could he improve that? So basically, the way I present the iPro, so when you get to this page, you would ask your customer or your anesthesia provider or your anesthesia tech, you would ask them, how are you taping, are you using surgical tape to close your patient's eyes currently? And that's what 90% of them are doing. They're using surgical tape. And they all recognize, so let's say they say, yes, we're using surgical tape to keep our eyes closed. And for those that are new to anesthesia, every time you get a general anesthetic, they tape your eyes closed, because during anesthesia, you lose the capability of keeping your eyes closed. And if your eye floats open, or your eyelid floats open and stays that way for an hour long or a 90-minute case or longer, you'll get an abrasion or eye problems as a result of that. So they always tape your eyes closed during general anesthetic, and patients are not aware of that. What the problem with surgical tape, so you would ask them, are you using surgical tape? And they would say yes. They may say they're using another piece of, another eye product called, it's actually got a blue tab. It doesn't even matter what it's called, but if they say, oh no, we're using something else, you might say, well, does it have a blue tab? And if it has a blue tab, that's a competitor, and we would have some specific advantages we talk about with this regards. But most of your competition is using basic surgical tape, and they all recognize that surgical tape is inherently in the OR is dirty, is full of germs, and in fact, many ORs will have anesthesia use single mini rolls of tape. In other words, there are tape rolls that only have a little bit of tape on them, and it forces the anesthesia provider or the user of that tape to throw the roll away. You'll still see, though, rolls that are pretty large, and those are multiple-use rolls, and they set them down on the anesthesia machine, and basically the anesthesia machine is not a clean surface or not routinely serviced. So wherever you're putting that tape, whether it's in your pocket or on the anesthesia machine, it's drawing germs. So the solution is do you want to use a product that, number one, is technically dirty and recognized to be not clean, and then the other problem is, do you want to use a product that has the potential of tearing off not only someone's eyelashes, but actually tearing their eyelids off? We have one of our biggest customers is MD Anderson Cancer Hospital. They were using surgical tape, and they while we were doing an in-service on another product, we were handing out samples of this, and that's when we learned that they have patients that have skin due to cancer treatments that is so frail and fragile that they have actually pulled off the surgical tape and it has torn off the eyelids of their patients, requiring their patients to have skin grafts. So that's a nightmare. So they were very excited about the iPro, and now they're buying, I think it's 4,000 pairs every 2 months of this product. So the way to show this is basically let them know that we have a sterile solution that comes with 2 iPros per package, and I always recommend putting this on the back of their hand. So you ask, can I use the back of your hand? And they always say yes. And basically you lay it down on their hand, and what you do is you just kind of tap the white area. And basically what we have there is an opportunity to describe this iPro as a technological enhancement to tape, because we're using dual zone adhesive. So we have more adhesive on the white area and less on the window. And generally what we recommend is when you place this over the closed eye, you generally just rub your finger along the white area and not on the window. What that does for the user, or the patient actually, is when you take it off, there's more adhesive on the outside, so when you peel it off, they'll actually feel more adhesive on the white, and they'll feel less on the clear window. And what that does for your patient and your anesthesia provider is it reduces the trauma that comes when they remove these. Now, obviously, we have 2 tabs, so we can remove it from either side, which is an advantage. The blue eye guard is what it's called, only has a tab on the one side. The blue eye guard is also just clean. It's not sterile. And the blue eye guard isn't really designed to seal the eye. What we do here is we seal it from external insults. So let's say they're prepping the head for a craniotomy or something, and betadine drips down. With this substance, we've actually sealed in the moisture and sealed out any external insults. By sealing in the moisture, you actually can see sometimes beads of moisture in the window, and that's telling you that, once again, you've got a nice seal that keeps the eye moist. The other thing I would tell you is that you do not need to use Lubriderm or eye drops. A lot of times they'll be putting a thick Lubriderm in someone's eyelids and then closing and then taping them closed. And the problem with that is when they wake up, everything's blurry to them and they start rubbing their eyes, and they can cause eye damage as a result of that. So with this product, you don't need any of that. Plus, when I pull it off, it doesn't pull off my eyelashes. Nowadays, women are getting eyelash extensions individually for each eyelash, and as a result, they're paying $150 a month to have those maintained. So we've had patients that do not want to have their eyelashes removed. We sell this at Barnes Hospital, and I had Dr. Gillihan spend like 3 or 4 minutes with me talking about how he used it recently on a patient that was more concerned about her eyelashes than she was about her anesthetic. So he recognized the value with regards to patients. So they use it routinely. So this is a very easy product to sample and a very easy product to present to your users. So the question you would ask is, Are you using surgical tape to keep your patient's eyes closed? And if they are, then you want to mention the fact that we know that that's not a clean solution and that you have a sterile solution. If they say they're using something else, you would ask, is it with a blue tab? And they would say yes. Then you would say, well, we have some advantages over that. We'd like to give you samples, and then you would hand them samples. We want to be fairly generous on the samples with the iPro. If it's a surgery center and they got 4 ORs, give them a dozen. If it's a hospital and they got 30 ORs, you know, you might consider giving them a half a box or a full box, depending on their interest level. So that's the iPro, and that's a product we want to lead with. On that same page in our catalog is the or the No Press. Now, No Press competes against a blue mask that is called the Bat Mask, and it basically looks like a crime fighter mask and is blue and has little bubbles on it. In fact, we used to sell it, and it generally sells for around $5 to $5.50. So we're actually less expensive with the No Press in a lot of situations. Now, the No Press also has adhesive that you can remove, and then you put it on to the patient. The key advantage with the No Press, and the question you would ask, do you ever use eye goggles, or do you ever use a blue mask that is designed to protect the eyes? And if they say yes, a lot of times they'll say, no, I don't use much, but you still want to show this, because the reason they don't use the blue one is because it's not a great solution. The blue one actually has adhesive that goes over the eyebrows. This one, you can see my eyebrows even through the video, and so as a result, the adhesive does not go over my eyebrows. The other one has to be cut sometimes, has to be adjusted, so this one fits universally, and basically what you do is you peel off the adhesive, you place it on the eye, forehead and eye and cheeks, and hold it for a second or two, and then it stays on. You would usually use the iPro first and then put this over on the the No Press. So, and the design of it is that it delivers or disperses pressure, if you will, over the entire eye position, whereas the blue one has a little bubble that ends up right over each eye. So you individually, if someone leans on that, or they put an instrument on it, or something happens with pressure, it puts an indentation right on the eye. Whereas this one, basically, if I put pressure on it, it spreads the pressure out over the bony structures of my forehead and my cheeks, and because it's one shield or one single piece, it literally, I cannot get to my eyes. So it basically is a superior design to that of the blue Bat Mask. So those are two eye protection products that we would like you to lead with. We now have samples of this. We had samples for a long time, and then we went into a situation where we had shortages. So now we've got samples. So if those folks like Jason, I don't believe we sent these to you, so we'll try to send some to you, and then if you get them to your team, that would be great. So that's the iPro and the No Press. Is there a question? A similar product, because it comes from Australia, is called VITA Knee. And I've gotten really good response to this. We haven't had super huge success as far as big orders for this like we've had with the No Press. No Press and iPro, we're selling cases at a time. So they really are, they're indicators for me of your activity and your work level. So those I expect you to sell and expect you to be successful with them. With the VITA Knee, I also think it's going to be a great product for us, but it's relatively newer than the other products. But we get this from Gas also, which is that Australian company. And the idea behind it is that it's designed to protect the airway and the patient's dental teeth, etc. So this happens to be an LMA, which is a laryngeal mask airway, and basically it goes in, instead of an endotracheal tube, let's say it's if you have a case that's an hour, 90 minutes or longer, they're going to go with an endotracheal tube, which you would still use this with. But if they're going to do a case that's 90 minutes or less, they might use a laryngeal mask airway or an LMA. And they basically put this inside the mouth, and it seals off the airway so that they can deliver oxygen and the anesthetics to you. The nice thing about the VITA Knee is it has a curved edge to it or side to it that allows it to fit within and be taped next to the LMA or the endotracheal tube. There are depth markings. It's got a blunted pointed end that allows you to insert it easily. It's a color that allows you to see it easy so they don't leave it in. Or right now, what are they using in place of this? They're using gauze. A lot of times they're taking 4x4s, multiple ones, wrapping them around the end of a tongue depressor, and then taking tape and taping that. And then they're sticking the tongue depressor with the gauze all the way back into the jaw between the molars. So that takes time for them to do. It's called MacGyvering. And what we want to do, if there's a product out there that's designed specifically for a purpose, they should be using that rather than MacGyvering something. And that rings true to a chief of anesthesia, because he might have 30 or 60 plus anesthesia providers doing different ways of delivering or monitoring CO2. They might have different ways of creating a bite block. They might have different ways of taping an eyes closed. Well, if we provide them with a tool that is designed specifically for that purpose, then they should consider strongly using that, because it will prevent errors and prevent lawsuits and claims and things like that. So once again, the bite knee can be put in the blunt side first and rested on the molars, and that's one way to use it. But most often it's taped to an airway such as an LMA like this, or it's taped to an endotracheal tube. I do have some customers that use one on each side of the LMA, and that's designed to make the LMA more stable so that if they're moving the patient during the anesthetic to get them in position, they don't lose the seal of their LMA. So those are 3 products that we import from Australia from a company called the Nogas. And those are 3 products we would like you to lead with and deliver samples to customers. As you page through our catalog, we have some other accessories that I would page through, intubation tools. Then we get into our video laryngoscopes, and you would just ask them, do you have any need for a video laryngoscope? We have both flexible scopes and video laryngoscopes, and this is our video laryngoscope. We have a program right now where we're offering this device at no charge, and you just use the disposable. So it has a list price of $3,300. We're selling demos at $2,450, and we're actually loaning them out on consignment when they commit to buying the disposable blades. So that's from a company called Insiders that we import from China. As we page through this, you'll come to a part that's our vigilant label system, and you would just ask them, would you be interested in an automatic labeling system that's integrated with your EMR? Because Vigilant currently is integrated with Epic, and basically they walk into the OR, they have a badge with a QR code or a code on it, and they shoot their badge twice, and out comes the labels for that specific case. The labels have their name and initials on it, the date and the time, and that meets current standards. The big area that I'd like you to stop and make sure you talk about with every customer is laryngoscopes. And the reason I mention that is just like capnography is making Neil Ward $8,000 to $12,000 a month, laryngoscope blades are making some of our other reps $2,000 and $3,000 plus a month because they're relatively they're used all throughout the hospital and very often. So when you get to laryngoscopes, I don't even know whether I would recommend paging through all of our alternatives. I would just stop there and ask, are you using disposable laryngoscope blades and handles, or what are you using? And they might say, oh, we're using disposable blades, but we're using reusable handles. If they're using reusable handles, the number one question you have to ask is, how are you cleaning those handles? Generally, if they're using reusable, they're just wiping them off. And that doesn't really meet current standards. But that's okay. That means they're going to be using disposable in the near future, because when they end up sending their reusable blades to Central Sterile to be cleaned, once they get told they have to do that, they come back and they quit working for them reliably. They go from working 99% of the time to working 60% of the time, and anesthesia hates that. So that's when they go to a disposable handle. We've sent samples to Jason and his team of Trinity, but I also have samples here of Carnegie, and I'll just mention that we have 2 of the highest quality disposable laryngoscope systems available. So we have the highest quality, and we have the lowest pricing. So we can beat anybody. We can, and the market leader is FlexiCare. FlexiCare uses a blue handle and a gray all-metal blade. So when you get to the laryngoscope section of our catalog, you would ask them, are you using reusable blades and reusable handles, or are you using disposables? And if they say we're using disposables, you need to verify if they're using disposable blades and handles. And then you might even, if they say we're using all disposable, then you might ask, can I see one of that you're using, and take a picture of it. Or they might say it's a blue handle. That usually means it's FlexiCare. They might say it's a green handle, and that means it's Rouge. So I know what they're using if you get me some information, but the ideal scenario is to get a picture of their of what they're using now. So whatever you go to a surgery center or a hospital, ask about laryngoscopes and see what anesthesia is using. Once again, most of them are still using a reusable handle. They may be doing something different with blades, but you'll come across some that are using both reusable blades and handles. And if you do, we still sell reusable blades and handles, but you want to make sure they know, and that's when I would give them some samples. Now, we sell the samples. We have we do a recycle program where we actually clean handles, so we can send out multiple handles that can be sent as samples. So, but we also have the Trinity handles in you know, this has a little tear off where I can hand this and they can use it. And if they're using reusable handles now, you can literally tell them, because they're wiping the tops, they're wiping those handles off. Well, there's no reason they can't wipe this handle off and use it for 30 days. We've done that before with other hospitals, and eventually they decide, hey, we probably should be using this as a single use only as it's designed, and then we end up winning that business because they're used to using our disposable handle and they reuse it. So the Trinity solution is our lowest cost alternative, but we've gotten new pricing from Carnegie also. So if I was determining what is the highest quality, I would probably say Carnegie is a little bit better in quality, but they're like a 5 on a scale of 1 to 5, and the Trinity would be like a 4.9. So they're both high quality systems. Sometimes we sell them pre-connected, where they're like this, where they're pre-packaged, and sometimes they're color-coded. This shows you one pre-packaged and color-coded. That's a Carnegie. And then we obviously sell the handles and the blades separately. The key thing on our blade that I would say is that, here, I'll get it out of my bag. Once again, I use a Ziploc bag, and I have multiple solutions in here. I'm able to open up my Ziploc bag, and we can pull out a couple samples of what we would show them. So the first thing we want you to do is just identify what your customer's using now. And I would say that's the theme of all of this, is identify what your customer's using now. If you can identify that and ideally take a picture of the packaging or the product, and then understand a little bit more of, in laryngoscopes, you know, how are they cleaning them now from a handle standpoint, etc., that can help us out. Then I'll help you with the detailing of the product. If you were to detail our laryngoscope blades, whether they're Carnegie or Trinity, the key thing is we're an all-metal blade, and we have this plastic footing, but inside the plastic footing is a metal reinforcement. That metal reinforcement basically is a rod that goes all the way up to the blade. So when they engage this to a handle, it basically has no give or flex. In the very beginning, when they first came out with disposable laryngoscopes, they were made often with plastic, and it was flimsy. This, you could pick up a 100-pound chest, if you will, or a 300-pound man. No matter what it is, this has the metal reinforcement for you to be able to do what you need to do. I'm going to jump to a different product because we're talking about laryngoscopes, but ask those questions. And what I'm excited about, we've had some really good early success with the pie pillow. Because if you're thinking about it, how do I get it? We have all kinds of difficult intubation products, but the key thing is they can be very expensive. A glide scope, to use a glide scope, might cost $30, $40 for the blade on the glide scope. And what they'd ideally like to do is intubate that patient with what's called direct view. So you have video laryngoscopes that kind of see and give you a picture off to the side of the airway, and then you try to navigate the endotracheal tube into that view, and sometimes that's challenging. However, if they would use the pie pillow, they would have that patient in what's called the sniffing position, and that would put them in a position that would allow them to do direct view, and virtually the intubation is easy, stress-free, doesn't require force, and the anesthesia providers love it. So what is the pie pillow? Basically, it's a support pillow. So now what your hospitals are using right now is they're using a square pillow right now, okay? And so that's a pillow, a headrest for the patient. So the patient comes in, they have them move over onto the operating room table, they rest their head on a square foam pillow. Or sometimes it's a reusable donut, but almost always now they're using some kind of a foam that they throw away. The difference is this is that same foam pillow that gives the patient's head, fits right in here and gives them support, but when it's time to do the intubation, I have the option of removing this portion, and then, I don't know whether I can do this or not, but basically my head ends up in what's called the sniffing position, and that allows the laryngoscope blade to go in and lift up the airway and the epiglottis, and I can see directly to the vocal cords. And when I see directly to the vocal cords, it's easy to put any endotracheal tube in. So the pie pillow is something that we can get samples on. For those of you who have been with Bell Medical a while, the pie pillow sampling is going to be similar to Joe Voss and the Pom Mask. We're going to be able to call them and ask them to send samples directly to us or directly to a specific customer that wants to evaluate the pie pillow. So this is the pie pillow for typical anesthesia, and it aids them in delivering the endotracheal tube. They come in, this one's actually started to expand, but they come in pressure-packed, vacuum-packed bags. We also have an obesity pillow that we're selling, and this is somewhat compressed with its packaging still, but once again, this competes with what's in our catalog. We are no longer selling the Troop pillow because this is so much better than the Troop pillow, and it's about half the cost of the Troop pillow. And basically, I don't know whether you can see that, but this has a place for the patient's head also, and this pillow removes. So if I'm on this ramp and then I remove this, I'm now naturally in that sniffing position that allows me to put the endotracheal tube in. And putting an endotracheal tube in an obese patient is potentially challenging and hazardous, and now we have a tool that we can do. Ours are a much better design than the Troop pillow, in my opinion, and all you need to do is sample it. So what I would recommend is whenever you sample the Troop pillow, let's try to get at least a couple samples of this to a customer, and then at least one sample of the Obesity Pillow pie system. Okay. Now that is not in our catalog. So what I would recommend you might do is print out several of our Road to Successes, which after this webinar I will send out. That's kind of a new and exciting thing for us that helps in intubation. So if you use the pie pillow, you may not need to use the glide scope. You may not need to use any bougies or anything else. So if you have routine use of the pie pillow available to you, it puts your patient in a ideal intubation position, which they often call the sniffing position because it's nose up, and that allows them to do direct view laryngoscopy, which means they're able to view it with a standard laryngoscope handle and blade system. So to leave blades, and handles, the main thing I want you to do is go into your ORs and your surgery centers and ask, are they using reusable or disposable, and if they're using disposable, find out what kind and take a picture of it and send it to me. If they're using reusable handles still, make sure you find out how they're cleaning them. And if they're just wiping them off, we got a great solution for them. Okay, I'm going to wrap this up because I don't like these ever lasting more than an hour. So we're on the home stretch. We're going to go fast. So those are all the different laryngoscope blades. We do still sell some reusable systems, but the real money and the direction of the industry is to go the disposable. Our disposables now, I think our handle is, we can go as low, we can go under $5 with our handle, and we can go under $4 with our blade. So we're competitive with everybody. We also have a bunch of different LMAs, and if you're in a surgery center, you would just once again ask what are they using now, and can you bid for that business. So we have multiple. Then we get to our anesthesia machine page. Now we are a distributor for Mindray, but and this is where you would ask the question: are you budgeted for any capital items such as anesthesia machines? And if they say no, then you would ask: are you budgeted for any other capital items like monitors? Because we both basically sell machines and monitors. We just sold a Mindray A4, and we have a quote going out again today for another Mindray A4. But we also sell pre-owned anesthesia machines, and the pre-owned anesthesia machines offer the customer an excellent value and great commissions for us. We just are about to quote 4 Estivas to a hospital, a surgery center in Southern California. One of the, this was a while ago, we sold 4 Draeger machines to a surgery center in Southern California, and the sales rep made a commission of $16,000. So they can be a great situation for the customer because they save a tremendous amount of money, but at the same time, it can be very profitable to us as salespeople. So it's kind of a win-win. The customer gets a great deal, and we make a higher than normal commission statement. We sell Gertie Marks needles, which if you're in a labor and delivery situation, talking to somebody from labor and delivery, give me a call and I'll give you a specific in-service on those. You get to the page on quantitative trainer for monitoring. Once again, the Road to Success has been updated to include EMG capabilities. This is a product called the TerraBoot. So when you're paging through this, you would ask them, you get to this page, this has to do with doing nerve blocks. So let's say you're getting a total knee or you're getting shoulder surgery. They'll give you a block up here that will deaden your shoulder, or they'll give you a block in the groin area to block your knee, so they can do surgery without having to give you as much anesthetic, and you can, and that's called a nerve block. So the StimPod 410 is for nerve blocks, and the TerraBoot, you would just ask them, do you do a lot of nerve blocks? Oh, you'd probably like the TerraBoot, especially if you're doing a lot of knees. We just sold 10 TerraBoots, I think, in the last 10 days or something. We get to a page on nerve stimulators. We still sell what I would call subjective nerve stimulators. So when anybody, you just ask them, do you buy these now? We guarantee you, that's another thing about our catalog, is we guarantee a minimum of 3% savings to any customers that reference someone else's catalog. So if they're looking at a nerve stimulator and it's out of a catalog and their price is $300, we'll sell it to them for 3% less than that $300. So in general, our catalog is fair and reasonable pricing, but we guarantee savings. We do have a couple respiratory products that we'll talk about at another opportunity. And then we go into some basic accessories like stylettes. We do have a syringe pump that has a great bolus button, and anesthesia loves it. We do temperature monitoring. That's surgery center stuff. They all have to monitor temperature, and I would recommend asking if we can bid for their temperature monitoring products. We have anesthesia machine covers from Anesthesia Hygiene. We also now have a lot of samples of those, so we're anxious to give you samples. And what I'd recommend is giving people samples of the one that goes over the tabletop, and that's a great solution. We make these and have these made for us in China. They're called drape clips. We'll try to send, we're on back order with those right now, but we're going to get a whole skid with, but we'll send out a box to each rep. I wouldn't give more than one to each customer that you make a call on, but when you give one away, they'll end up saying, oh, I need more of these. And then we have our Bell Medical t-shirts that say sleep with the best on the back. What I'd recommend with those is when you have a customer that could be a potentially big customer, like an anesthesia tech that's the main tech for a university hospital, or maybe any anesthesia contact or a manager, but generally an anesthesia contact. If they've done something nice for you or you're asking them to do something nice for you, gauge what size they are and call us up, and we'll send you a couple t-shirts, one specifically for that patient's size, and they cost us less than $10, and I'm amazed how appreciative a customer is these days, because you can't always buy them things, or drug companies aren't giving them things anymore as they go. So that's kind of an overview of what we would like you to do, and I'll basically open it up to questions. We're right at 60 minutes or 58 minutes, so I'm going to turn off the recording. But